Now it is my distinct pleasure to introduce the infamous Jim Sheehan. Mr. Sheehan was appointed in October 2011 by New York Mayor Bloomberg and Commissioner Robert DOAR to serve as the first Chief Integrity Officer of Human Resources Administration, HRA, the nation's largest social services agency with over 21,000 employees. HRA oversees the Medicaid program, food stamps, cash assistance, job training, and other services for over 3 million New Yorkers. As Chief Integrity Officer, he is responsible for both internal employee and external healthcare providers, contractors, and beneficiaries, program integrity for HRA. Please welcome Jim Sheehan.
Thank you very much. Every speaker has told you about the lights. It's true. As Sean said, well, okay, let's go back a second. For the last 20-some years, I've been an advocate for compliance and for compliance programs, and I've told people how to run them, right? And so if you go back to the New York State Medicaid Inspector General website, which still exists, there's lots of ideas about how to do it. There's lots of instruction about how to do it. There are lots of examples. I've litigated about compliance issues. The one thing I had never done was to be a compliance officer. But I knew everything about it because I'd been working on it for 20 years. So today I want to walk through a top 10 list, but the top 8 things are things that I knew before I became a compliance officer. A little bit of commercial for my sponsor. The New York City Human Resources Administration is the nation's largest human services agency. We updated the numbers. We now have 21,000 and 3 million enrollees. There are 1,200 employees that work in the unit that reports to me, which I was shocked at when I took the job. And also, I have internal audit. You ask, how big is your compliance staff? My compliance staff right now is me. And my job is to figure out, because it's the first time anybody has had this job, how many people do we need? What do they need to be doing? How do we need to make it work? Okay. So the first issue that I confront as the compliance officer for HRA is that in healthcare, you'll recognize this. There's a lot of people who think they don't need a compliance officer, right? We're the good guys. The other guys are the ones who need the compliance officers. And the commitment of our organization, it's a human services organization, benefits for people in need, social safety net, accessible health insurance, work opportunities and family support, program integrity. They believe they already do all this. And so there was some concern about what use or what purpose it was for the commissioner to appoint me. So let's walk through the first thing that I knew before I became a compliance officer. You know, we've always talked about hotlines and how critical they are and how they're an important element of a very good compliance program. And I remember taking depositions of compliance officers and asking them what kind of system they had for managing the hotline complaints and how they tracked them and what they knew about them. And I would, on occasion, was surprised to learn they didn't know about all of them. So here's what I learned about hotline complaints. Many of them are not useful. Some of them are incomprehensible. And many cannot be followed up because you can't figure out who it came from, what they're complaining about, or what exactly it is that they're concerned about. Thank you. Many hotline calls involve personnel issues, and the first temptation is to start to get involved in these issues because their people have real concerns, and maybe they have a boss who's a jerk or colleagues who are problems. If you do that, you'll be ground into dust. So that's why you go back to personnel and say, please, this is your job. Some hotline free compliers need a life. Or psychiatric assistance, because this is what they do with their leisure time. And we've had hotline complaints that say, please don't call me till afternoon because I don't get up till then. Next one. Lou Morris and I have said for years that the compliance officer should be independent of in-house counsel. All right, and I think I still believe that. But here's what I learned when I went to a large organization. The most critical relationship for a compliance officer in an organization, apart from the one that's up, is with the General Counsel. And if your General Counsel is supportive and believes we're working toward the same goals, it can work tremendously successfully. But if it's not, And even if the general counsel is on your team, there are going to be people in his or her organization that have concerns about how this relates to the legal side. Most serious compliance issues require counsel advice, assistance, and policy decisions and management. So the structure that I envisioned, which was independence, is in practical terms very hard to do and probably not a good idea. So one of the issues that we're working through is, what should that relationship be? How should it work? And I don't have an answer for you today, but I'm much more conscious of how the role has to work to be successful. And the other thing is, there can only be one general counsel. Now, I came in, I'm a recovering lawyer, I have a law degree, I still have bar memberships, but there's only one general counsel. And so when they sit around a table and say, what is the legal issue here, my appropriate role is deference, right? I can have my own opinions, but I shouldn't speak first. Next thing. I thought the most difficult part of being a compliance officer would be getting powerful senior people in the organization to follow the rules. Guess what? The senior people that I've met in HRA, they're human services professionals. They're in their genes is a rule-following behavior. And that's how they succeeded to get to where they are, including as well as doing good work. The most difficult part is getting information about problems involving mid-level staff, right? What's really going on out there? And when I was being defensive about what I was doing, I said, well, it's a very big city, that, there are 5 boroughs, we have 12 offices, and then I talked to some of you, have nationwide organizations, or in some cases international organizations, and I realized, as an excuse, that's pretty lame. But the key is, how do you find out what's going on with mid-level managers? How do you find out what's going on with vendors? We manage $40 billion worth of contracts and services, many of which are provided by private vendors and private providers. How do we find out what's going on with them? And one of the challenges in compliance that I'm finding is to get your message to a hierarchical organization is relatively easy compared to finding out who your vendors are, finding out what they do, finding out what their contractual obligations are. So that part has been a real challenge. Here's the next thing that I knew, and I remember getting up at these conferences and saying, well, if you don't know what the answer is, you should call up the agency and make a record of what they say. Sounds like great advice, doesn't it? So here's what I learned, right? And of course, I was building on my experience, right? I was in the New York state government and in the federal government. When I had a question in the federal government, I'd call CMS and I'd find somebody or go visit them. And because I was with the Department of Justice, they'd actually talk to me and sit down and walk me through. When I got to the state, I'd walk across the Department of Health and say, okay, here's this regulation, here's this issue, where do we stand on it? I'd get a learned dissertation from somebody who'd worked on that their entire lives. So now I get to the city, all right? And the city, as they tell me in Albany when I visit, is not the state, all right? The city is a vassal organization. It is created by the state. It exists for the purpose of the state. Now, New York thinks it's its own country, so let's put that aside for the moment. But what I learned is when you reach out as a non-Fed and a non-state person to these agencies and you want information about a program, many of these programs have no parent. They are orphans, right? Some legislator created them 20 years ago. That legislator has his name on a bridge or a building or a subway station, but he's been dead for 10 years. And nobody will take ownership of the organization. That's problematic, but at least that program has one father or mother. The more difficult ones are ones where the program is the subject of constant custody and visitation battles. So there are programs that are funded by the feds, sponsored by the Congress, run by the states, overseen by the states, telling the city what to do. So you call up and say, who can tell me what the rule is on this? Well, first you have to get through the voicemail and telephone lines, but there's no one. I mean, in many government organizations today, I learned, when somebody retires, nobody replaces them, and they take all their papers, and they still have papers, and they put in the dumpster because they're consolidating offices. So, first question is, will anyone answer the phone? And I found the answer to that is often no. Will they admit to knowing anything, right? You shouldn't talk to us, you should call the next agency down the road. How do you make a record of being unable to reach a human? And this is an issue that I've confronted on frequent occasions, so my advice that says call up and make a record is a challenge. Okay, the next thing that I thought right? And I would sit in depositions and I'd go through and ask really clever questions, and sometimes people couldn't answer them. And I assumed that how compliance officers worked was they'd receive issues, they'd think deep thoughts, right? They'd had an orderly analytic process involving a careful review of the facts and the law. And this was a great concept. Here's what I learned. Every day, people come to you with stuff, right? And you have no idea, right? I could not even understand what the acronym meant, so I'd be listening to the language and trying to figure out, what is this? And so when you first start, you're trying to be positive and helpful and give it your best guess. And then you realize some people ask the question because they want the answer they're going to give you, and some people ask you questions they really want to know the correct answer. But the problem is, it's an awful lot like air hockey, right? You're defending a goal and the puck is coming in from 20 different directions, and every once in a while one is going to slip past you. So what you end up doing is relying on, in complex issues, you're not going to know it all, you're not going to have that orderly analytic process, but part of what you're hired for is your judgment. And part of that judgment is relying on the knowledge, judgment, and good faith of your colleagues, and some of your guesses will be wrong. Very distressing, because the Department of Justice, we didn't produce a lot, right? If you look at the Department of Justice, every once in a while there's a big case that comes out. The focus in the organization was on getting it right in terms of the case. But an organization that actually produces things and does things, it's very difficult to have that kind of review. And there aren't enough compliance officers in the world to do the kind of analytic process that I contemplated. So thinking about moving from that very static approach to a very dynamic approach where this stuff comes in has been a huge challenge. Next issue. I thought compliance officers oversee the compliance program of the entire entity, right? That's their job, that's their title. And what did I find out? Well, even though I was the first compliance officer at HRA, there are a whole bunch of people that own little pieces of the compliance function. Legal had some, audit had some, finance had some were, again, orphans. But there are a lot of people doing a little bit of compliance, or something that looks like compliance. And because there's been no central consolidation of that or central control of that, it's like the Galapagos, right? There are little islands out there, and they breed very strange creatures. So when you show up from the mainland and say, this is how it has to be, that means they're extinction, so they're not so happy about it. Border and boundary discussions are an important part of this job. Respectful, polite, appropriate, but you've got to consider what else is out there that is a compliance-related activity and what your appropriate role should be. And the truth is, you can't take them all over because you can't possibly have the staff or the expertise, but the flip side is you can't leave them by themselves to keep doing what they've been doing in the past and not know what they're doing. Okay. Next thing. Now remember, Department of Justice, Medicaid Inspector General, right? We do start an investigation, we spend 2 or 3 years working on it, we centralize and control it, there's one person in charge or a very small group in charge. So I assumed that large organizations would do the same thing, right? Forgetting, right? What the product of the Department of Justice is cases. The product of most healthcare organizations and human services organizations is running a program or running an operation or running a business. And so one of the things is in a large organization, people don't succeed in those organizations and have the organization succeed by waiting for central direction. All right? So I assumed that you come in, you centralize the problem, you control it, and compliance and counsel would do that together. Wrong. Here's what happens. Life and business goes on. And with a significant problem, some people move to solve it on their own, right? Because these are operational problems. When I found, for example, if there's an enrollment issue with our beneficiaries, well, every year we have to re-enroll 3 million Medicaid beneficiaries. And if you slow that process down, the entire thing stops. So the person in charge of the Medicaid enrollment process is thinking, what do I do next? What do I do next to keep this going? And to do that, they write memos and emails, they call people inside and outside the organization, and they make statements without knowing, what I would say as a lawyer, all the facts. But they have to do it in a lot of cases, or perceive they have to do it, because you know, the show must go on, they must continue the work they're doing. There are more important things, shocking thought, than the case, right? For healthcare organizations, there are life and death decisions and care decisions. For our organizations, you know, there are people who survive on the benefits we provide. So we need to make sure they keep going out. And that's critical. So the idea that you could centralize and control is a mistake. And again, it's moving from this idea of central authority to the idea of cooperation and knowing what else is going on. Okay. Here's the next thing that I learned what I knew before I became a compliance officer. What's the most important consequence for an organization about an investigation or an audit? In my view, was potential liability. And why is that? Well, I was a lawyer. My friends were lawyers. My opponents were lawyers. And lawyers, I now realize, have an exaggerated sense of their importance in the universe. And so when you look at an organization, at HRA, and the problem is not so much the ultimate outcome, which may be 2, 3, or 4 years down the road. The most important issue in an investigation for the organization is uncertainty. It's uncertainty about funding. It's uncertainty about the leadership. Will this affect who's in charge and their effectiveness? About support. What is the public response to the fact of investigation? Forget the issue of what's going to happen at the end. Can we hire our key people if there's the threat of investigation hanging over us? Will we have business opportunities and partnerships that we can do if this issue is out there? So the ultimate outcome may be years down the road, but the focus is, well, how do we handle the uncertainty that exists today? And so, again, part of the compliance function is making sure you understand that that is what drives the decision makers, that's what drives the organization. The reputation in the long term on the outcome is a problem, but the reputation of the organization in the short term has huge impacts regardless of what the outcome of the investigation is. And you may say this is obvious, but believe me, crossing over, it has been a revelation. So, short story, because we handle $40 billion in federal, state, and local funds, and because there is no exemption from the False Claims Act for municipalities, there is for states, but not for municipalities, I sat for the first time on the other side of the table from a Department of Justice attorney doing an initial presentation about a false claims case involving my client, involving my organization. And I'd known this woman for 30 years. Her parents went to the same church that mine did in a small town in Long Island. And we were friendly as professional colleagues. And she said everything correctly according to the Department of Justice book. And I knew that because I was going through and listening to it and realizing this is exactly what I said in the same situation. But you know what? Boy, does it sound different when you're sitting on the other side of the table. And the reaction is to be defensive. And you know, this is not this part of the brain thinking, it's this part of the brain thinking in the back. You know, what are they, who is these relators, how can they say these things about us? And so that this issue of uncertainty and what it means and how long it will take and what the impact of the investigation itself is significant. The next thing that I thought was, again, the Department of Justice, what's our product? Cases. And what's our belief? That convictions and large settlements have an impact on an industry, otherwise there's very little impact. What fascinated me once I got inside an organization was many business people actually overstate the significance and impact of cases involving people or organizations that they know, even at early stages of an investigation. So, give you an example. When I was coming out of law school, we were all applying to law firms and government organizations for jobs. And you'd be interviewed by 3 or 4. And so we're all 24-year-olds trying to make judgments about large business organizations who are trying to put their best face forward while we put our best face forward. You know what? We didn't know anything. But it didn't stop us from opining on a regular basis because we're going to make a very important life decision at that stage. And in the absence of information, you fill the gap. You fill the space with whatever you have. And what interested me, having worked and lived inside the investigations, to watch business people's reactions. So if a person they knew had been the subject of investigation. They had a very different attitude and approach and understanding. They were conscious of the kinds of cases that had been brought and the effect. And so I was amazed that people overstated the impact. And I think this is, in some ways, a real risk. Our justice system is built on the idea, innocent until proven guilty. And from the justice side, our view was, we work very hard to put together cases that are defensible and watertight and airtight. But I think one of the difficulties in making the transition is when people read an accusation, even in that whistleblower context, where they know there's an investigation, they jump to conclusions based upon what they think is out there. So part of my job is giving people more confidence. We're a good organization. This is what we do. These are the systems we have. It's an inevitable fact of life that investigations happen. But the changes in behavior, the anxiety within the organization about that uncertainty is huge. So those are sort of my 8 things that I thought I knew before I started as a corporate integrity officer that turned out to be problematic. And I'm now finished my first 6 months, so I don't pretend to know an awful lot, which I guess is a helpful start for this kind of job. And I'm looking forward to the education process as I go. When I first started, they gave me a sheet. And it was a sheet of the acronyms that are used at HRA, Human Resource Administration. There were 300. And you needed a concordance, you needed a charge master to translate, because very often what would happen is, 3 generations ago in this organization, they'd used a certain acronym, right? And it morphed over the next 20, 30 years. And so now the people who've been there for 30 years still call it by its first acronym, and then the second group call it by its second, and the third call it by its third. So this learning curve process has been really steep and a challenge. The things that I knew before I became a compliance officer turned out to be absolutely accurate. The tone and commitment from the top is absolutely critical to success. And I believe this and I said it, but I wasn't sure how it would play out in practice. The city is a very hierarchical organization. Department of Justice, by the way, is not an organization. It's a cluster of loosely connected organizations that occasionally talk to each other. So I wasn't accustomed, when the Attorney General said things when I was an assistant U.S. attorney, that was kind of nice, but my boss was in Philadelphia, and he was the one I had to listen to, and then there were many other fiefdoms in other places. But in an organization like the city, which has literally hundreds of thousands of employees, the top is critical. And Mayor Bloomberg has done 2 things that I think are really significant. One is everything gets measured, all right? If you can't measure it, you can't manage it. Obvious private sector concept. Believe me, the public sector is far behind in most places in addressing that issue. But Mayor Bloomberg made his personal and professional career on measuring things to manage them and having the information to do it, and he's done that. The second thing is ethical standards within city government. So I've been very impressed with the kinds of oversight and controls that exist from a more traditional inspector general perspective, but also for the stuff that I am working on. So Commissioner DOAR, the reason I have this job, I was, in August of last year, I found myself between administrations, and so I was talking to various people about ideas about what I should do next, and I talked to some of the people in this room. And they tell you in job searches, you never know where that opportunity is going to come from and the one that you really want. So I'm sitting with my cell phone by the pool because, of course, I'm a gentleman of leisure for a month. And the phone rings, and it's a friend of mine who is a lobbyist in Albany. And he says, I was just talking to Commissioner DOAR, and I think that you and he have something in common that you should talk about. All right? He said, I think you should give him a call. And I called him up, and he said, no one has ever done this before, but I have an idea. And I've watched what you did at Medicaid Inspector General. I think we need a Chief Integrity Officer within HRA. I think it's the time to do it. I think there's support for it in the mayor's office. And so this is a job that did not exist for anybody before Commissioner DOAR thought it up. So what I get from him is support for the idea, support for me as a person, support for the program, and daily contact. And it makes a huge difference in working with my peers and working with my staff. The next thing about that I knew before I became a compliance officer, and this is, I guess this is belief, but I think it's also knowledge. Most people, most of the time, want to do the right thing. And the question is, how do you give them a structure and a process to be able to do that and to point out when it doesn't happen? Most people want to be part of an organization they're proud of. I've been amazed since I got to HRA. Actually, every government I worked for, starting with when I was 23 and I came to Albany the first time, there are an amazing number of people in government, civil servants and appointees, who are committed to the mission, committed to the goals of government, and really enjoy their jobs because they think they're making a difference. And I think they are too. And so that's true of your healthcare organizations as well. But one of the problems that people face is when there's a disconnect between what they believe they're there for and what they believe they want to do and what they see around them. And so part of what I've been finding in this job and others is giving people an opportunity to feel the organization reflects their values and goals is huge. And in some ways, even more so in the government, just because a lot of people sign up. That's not fair. But in my life experience, people sign up with a sense of mission. Over time, sometimes it becomes attenuated, but they want to feel that pride. They want to feel that commitment to doing the right thing. And effective compliance programs, whether they're in healthcare or other large organizations or us, help the people do the right thing and be part of a great organization. So with that, what I'd like to do, I look back when HCCA first started back, I think, in 1995. I remember going to the first meetings, and we didn't really know, well, I'm sure Roy knew, but we didn't really know what this was going to look like, right? One of the first cases large cases I worked on, the University of Pennsylvania case, one of the solutions to the problems we'd observed was a central compliance function, but it was a brand new idea, all right? And if you look around this room today, you see 2,400 people who are now professionals in the field that didn't exist in 1990, all right? In some ways, and SCCE is trying to spread that concept to other industries and is doing a good job of it. In government, we have not really had a compliance model. We've had an inspector general model, and I'm a graduate of that process too. It's a very different model. Right? The inspector general model is to stand outside, to be independent, to identify issues, to report on them, and then to move on. The compliance model is much more collaborative and cooperative. And the idea is that you're going to look for system weaknesses, you're going to look for potential problems, and work collaboratively to address them as they come along. And that is, in some ways, that idea that you look for problems not so you can do a case or you can do a report, but you're going to sit down with the people in the program and try to solve them, I think is a huge step forward. But I will tell you that compliance programs in public sector agencies, other than hospitals and universities, are very rare. And in preparing for this job, I called up, I did my usual Google search, compliance officer and city and state and some a bunch of other things. Not a lot came up. But I found one person who had been a compliance officer for a very large city, whom I'm not going to name. And I found her, at least I found press reports of her existence, and then I found that she was at a new job, called up that place. She'd left that job as well, and tried to find her from professional reporting, professional kinds of organizations. Nothing's coming up. So she was a lawyer, and so I went to a state bar. And if you're looking for lawyers, they actually will give, and you're in the fraternity, they'll actually give you the address and a phone number. So I got that. And so I called her. And I said, I see that you're the first compliance officer for this jurisdiction. Tell me what it was like. She said, it was a real challenge, but it was the worst job in my entire professional career. This is after I'd accepted the job and was just starting. And I said, well, what happened? She said, well, I got caught between the prosecutors over here and the Inspector General on one side, a federal court case, and the agencies that I was trying to oversee who felt I was sort of invading their territory by doing what I did. So I said, if you were to do it differently, tell me what you would do. And she was very thoughtful. By the way, the first thing she said was, how did you ever find me? She now works for a large food services organization as a compliance officer. She said, this is 10 times easier than working for the city that I was in before. So I followed her advice, just as I followed Brian Flood's advice when I became Inspector General in New York. But I really, if you know of people who take this job, please put them in touch with me. I'd like to help them. I'd like to see the things that they're going through. And we just as you in healthcare, and I'm in healthcare too, have an organization. You walk through these presentations and you talk to people in the hallways, you learn a tremendous amount that you can take back. And you get a tremendous amount of encouragement from just being together. We in the public sector need the same kind of network, and right now we don't have it. So if you know of friends who are considering these jobs, have them call me. If you have friends who already have these jobs or have left them, we'd like to talk together to see how we can make it better, to do for the public sector what you've already done for the healthcare sector. And with that, you've got my email address from the City of New York, my phone number. I appreciate the phone calls I get from people. And I did catch Sean, the infamous Jim Sheehan. I'm hoping to work on that a little bit going forward. But this is such a great organization, and it's a great profession. You can see, I guess you can't see, but I don't have my card. I'm now certified in healthcare compliance, and I'm looking forward to working with you another 10 years in this business. Thank you.